welcome back. We've got Dr. Nimmi Kapoor. Thank you so much for being here. And you're with Breastlink.
Yes.
Tell us a little bit about what that is.
So I was so excited to find this group. It's a multidisciplinary group, meaning we have radiology that are all specializing in breast cancer care and breast care, healthy breast care as well. We have medical oncology and we have surgery all under one roof. We all work together to make sure that each patient is treated comprehensively. They get everything all at once.
What exactly does that mean? A patient gets everything all at once.
Okay, that's
Are
important.
you like on a conveyor belt where
Right.
like
Initial
all doctors
diagnosis on through your treatment, through
It means
surgery,
that we
everything.
do screening. We
Right.
check healthy, normal women. We
Okay.
do exams with the surgeons. We do our own clinical exam given by a doctor, such as myself or Dr. John West. And then if we do end up finding cancer in someone, we do the treatment. We do the surgical treatment. We do the medical treatment all together. Dr. John Link with us is one of our medical oncologists who's well known, and we all work together to do this.
That's such a relief
Yeah,
because
so-
it's so stressful to have to go to one place for
Right.
this treatment, one place for this
It's literally
treatment.
all
And-
under one roof.
I
so
feel like
can
you
just
didn't
handle
tell
everything.
someone the right information. You know,
Right.
you're communicating. So is it kind of a joint effort that you're coming
Absolutely.
together? Because sometimes it feels so
Absolutely.
scary. Like, what if I didn't tell them, that I, drink 2 glasses of wine a day or something like,
Right.
just making that up. I drink 3. No, just, but just things like that where, making sure that you're telling everyone the complete information about yourself. And did you miss something? So
Right.
your doctors are all on the same page.
Yeah, and we're all specialized and focused on this. All of us have done extra research, extra training, and we come together as a group every week actually to discuss each cancer case so that we give a complete, well-rounded opinion of what needs to be done.
So is Breastlink can also play where there's education?
Absolutely.
Okay.
I mean, that was one thing that I found very different from bigger, more cumbersome academic centers. We do a lot of patient education, and we spend a lot of time trying to teach patients about breast cancer awareness, breast health,
Right.
learning
And I
how
think
to
your
do
organization really
self-exam.
personalizes it for that patient. They give it a little bit more insight as to what they have to go through or what is going to be involved here.
Yeah.
And I think that's very comforting to a
One
patient.
really nice thing that we do that I learned that we do is we have a volunteer who's a cancer survivor matched to every cancer patient.
Oh, that's great.
So they actually together go through the process, and
Right.
so
That's really crucial.
But is
to
that
talk
scary
to
for
someone
someone?
who's been through it, that's really
But is
crucial.
it also scary because I have an aunt who's currently going through breast cancer, and I just talked to her yesterday, and she's like, "Oh, I'm getting my peach fuzz back on my hair, and I have a few eyelashes that are coming back." And I think in some ways, yes, it's important to kind of see the progression
Right.
of where you're going to go. But is it like too much information too fast for some patients?
well, we carefully match
Okay.
volunteers with patients. Actually, yeah, we don't want to scare patients, but at the same time, it's really important to embrace the knowledge and know and understand what's coming, what I'm going to feel like, what to expect. Because when you're ready and prepared, it's so much easier to fight a battle than if you don't
It's
know.
really important to fight and not to
Yeah.
sit back and be depressed about it. You've
How
got to stand up
do you
and fight for
coach
yourself.
a patient through that experience when
Right.
you just diagnose someone
Yeah.
with cancer? That must be one of the scariest moments of a person's life.
Yeah.
How do you guide a person through that experience?
It's still, for me, very emotional. Each patient's a little bit different. Each patient has a different understanding and background where they're coming from. I call them on the phone before they come in to see me. I kind of go through some very basics of what to expect when they come in. I tell them to bring a friend.
Good idea.
Either
Do they know right there?
Support.
Oh,
Support
it's
is so
not going to go
important.
well.
a
Right.
tape recorder if necessary, a
Good.
notebook. I mean, I want them to be prepared. I want them to know that this is a long journey, but we're going to do this together.
Why a tape recorder?
Sometimes they
To
forget.
remember
Right.
things.
You know, when
and
you're in a
yeah,
you're in a
there's so
haze.
much to divulge.
You're
and
in a
so much to
haze.
digest all at once.
But is
know?
it too much to tell someone over the phone initially? I know that you're like preparing them, but
Right.
you don't know where they're at in their house or what happened that day. And I think that's good because you're like forewarning them. But is it also tough?
But at what
not
great
being
time
there?
do you tell somebody they have
Well,
Right,
breast
there is no
cancer?
right
There's
time.
no right time.
There
Yeah.
is no
This
right
is
time.
such a great conversation, ladies. I
Yeah.
want to pick this up right after the break. We'll be right back.